your
get
spouse,
ready.
make some coffee. Gonna be here all night.
This is not sponsored by Starbucks, but we love them.
No, I actually already powered down coffee and 2 sodas. So
What
this is
a
not
huge
ready.
year we've had.
This is the year in review, the State of the Union of the Arthritis Center.
My chair's a little.
You're the
It
one
makes
who
me
wanted that
bug.
chair.
Is there? Okay, don't worry. We're gonna restart it again.
Okay.
Okay.
All right. Here we go.
So here we are. Probably it'll be posted tomorrow, so halfway through December.
Okay.
How much have we done in 1 year?
So this year of 2024 has been amazing and
Heartbreaking.
heartbreaking. I have a broken heart, a full heart, and a business high. Right?
Yeah, you just had the highlight of your career. That was with Dr. Glockenflecken.
Being interviewed by Dr. Glockenflecken is my personal business high, and that was only made possible because of the social media that she's done.
I think everyone's almost Dr. Glockenflecken's known by everyone.
He
You know,
is
he's a
in
comedian.
healthcare.
No,
Right.
even not in healthcare. I think he comes up on a lot of people's feet. Like he's a very well-known person. So that
Right.
is, and I think if we would have talked to ourselves a year ago when Wendell responded to your email, and we would have never believed we're here.
No, I couldn't believe that Wendell Potter was in my office. I remember thinking, this is never going to happen. I intellectually hear the words that Wendell's coming, but I didn't believe
Till
it.
the very last day.
Until
She's
I
like,
picked him up from the airport.
no, literally, she was like, yeah, they can't give me his flight schedule, so I'll believe it when I see it.
Uh-huh.
And the next thing we know, she's like sending me a selfie with her and him in the car. Usually,
And I don't do airport
I'm
pickups.
usually airport pickup, but this time this old girl got out there and
Yes,
picked
I
him
did.
up.
Yes, I did. I did. I did an airport pickup.
Well, and it's so funny because you can tell how excited we are. He's in the office because, like, on our TikTok, we're not even letting him speak. We're just like, it's Wendell!
I know. It's like,
And now he's becoming like a household name. He's on CNN. He's on
he's
Time.
got so much media going on because of United Health Cartel and Aetna and Cigna and Anthem and all the denial teams. And it is so amazing to me that because of Team Luigi, that now the United States of America can have a conversation about how we're all being screwed by our insurance companies and the pharmacy benefit managers.
Let's talk about Luigi. I personally think he's a modern day Robin Hood.
Of course, he's a modern day Robin Hood.
And a very intelligent one, too. Did you read his papers?
Oh, yeah. I mean, he's, he was at Stanford, for God's sake.
Valedictorian.
But here's the thing. Luigi probably had,
His mom.
well, he did have a rheumatology condition, which is what we do, rheumatology here. So he probably could have been helped by infusions.
Well, and when
or
he was
biologic.
talking about his mom, like, screaming in pain, all I could think about is you whenever your back hurt. And, like, whenever you would go down in pain, I would just, like you don't know what to do because you literally fell to your knees in tears and pain. So I imagine him seeing his mom like that and it progressively getting worse, and your parent, there's nothing you can do. You're paying insurance. You see your parents are paying insurance, and she's still in agonizing pain. And you had to pay your deductible, or not even your deductible. You had to pay out of pocket.
Out of pocket for all of my MRIs, because I actually started this year with back surgery on February 26th because I hurt myself on the tennis court. So I ended up with an L5-S1 microdissection, second time within 3 years on the same disc space.
What month was that?
That happened January 19th is when I fell.
So January 19th, we
2024.
started with a back surgery. That's the start of our year so far.
Yeah. And my back surgery was February 26th, 2024. And we were the last surgery at Christian Hospital that Dr. Levy could perform.
I had to send cakes.
Yep.
I called them constantly. Dr. Levy was like, your staff is very, very persistent. And I was like, it was me off of every single person's phone.
It was.
But thank God we got that.
Right?
And I was just sitting in the waiting room like, do. And Dr. Bach was very protective over you. So I'm like, Dr. Levy, I'd appreciate if you would just call that man, because if I say one word wrong, it's off with the head. He already thinks I'm a nimwit, kinda.
It worked out. But from that, we got some really good traction in spending some significant time together when you were convalescing me.
Well, that's whenever we actually people learned about peer-to-peers.
Oh, that's right, because Dr. Bach had to do a peer-to-peer for my stupid
And they
MRI
wanted
that I
to give you
had
a
to cash
knee.
pay.
They wanted to give you a knee MRI.
And not
A
a
hip.
lower back and hip. Right.
And so he's on there and he's like, well, that just logically makes absolutely no sense. Our morals are not vertically aligned.
Yeah. So we started off the year with me having a back injury, and
I think maybe that anger's kind of stayed with us though. Like you were in so much pain and we were being feisty, and I think we were like, all right, we're just going to be feisty all the time because nobody talks to insurance the way we do.
Well, I mean, I had the ability to pull together money for an MRI and cash pay an MRI, and I had to pay even my insurance. Actually, once we got it prior authorized and did the peer-to-peer, it was more expensive for me to use my insurance for an MRI with what my portion was than if I would have cash paid it. And all of the bullshit delays and all of the nonsense for what? I am the employer. I pay 50% of everyone's premiums in this office, and I also pay 50% on my own, and I couldn't get access to healthcare. What? That is the story.
And that's why Robin came around.
It doesn't matter if you have money or not. If you have insurance, you are fighting tooth and nail to use it. And then once you finally get the approval, you get to pay more. It's like an expensive coupon.
They've inserted themselves into the patient-doctor trusted relationship in a way. Like, and for some reason, there's still people out there that think insurance is there to help them. They're like, doctors are out there just prescribing willy-nilly proceed. I'm like, well, so you've clearly never tried to get something authorized.
Well, look at Andrew Whitty, the president or whatever the hell he is of United Health Cartel. I mean, he is still saying that United Healthcare has a very significant role in making sure that unnecessary care isn't delivered. Are you kidding me? You don't care if the patients need something. You all deem it unnecessary because you need to take a piece of it. Redonkulous. I am so hopeful that our experience, strength, and hope that we have shared this whole year and what we've been through with my back surgery, with our claims clinic.
And then we had the claimable clinic come in,
so
that's when Morris.
We met Boris Bakari, a physician, on Twitter, and he, only because I terminated our Cigna contract in August of 2023, I started railing on Cigna, and we met Boris the first time we met Boris face to face was on March 4th, which actually was my birthday this year. Okay.
So
we've only known
from
Boris.
January to March, we're doing that.
Right.
And then what was after that?
So Boris came out here. Boris has been up to St. Louis 4 times, but he brought Alicia out on March 4th, which was my birthday, and Dr. Bach was also in the hospital on March 3rd because I picked him up from. He had one of those spells, right? That he had, and he had an MRI, and it was fine.
So Dr. Bach was having these like really faint, dizzy spells, and we'd give him fluids, and usually the fluids would get him right back on his feet. So it just kind of became part of our routine, I would say,
to give him fluids. Anyway, it was a crazy day. March 4th was my birthday. March 4th, I was in the emergency room with Dr. Bach, and I was supposed to pick Boris up at 8:30 in the morning, and I text him, who I've never met him before, and said, I'm going to be there at 10:30 because at midnight I was still in the emergency room. And I picked him, Dr. Bach and I picked him up at 10:30. We brought him here. I didn't even know how long they were staying.
We didn't. You're right. We had no idea.
Yeah, they were here for 2 days, and we did 2 patient appeals, and it was so amazing because they were fangirling over what we've done. And we were fangirling over the possibilities that these people are going to help patients.
We had maybe 10,000 followers.
Yeah.
Yeah. And then we just, once we got our first 1,000, you couldn't tell me and Julie and I that we weren't famous. We saw 1,000 views and we're like, all right, where's our star on the Walk of Fame?
Right. Listen, I mean, it's all about getting the right patient on the right medicine, and it's never going to be one size fits all, or even one size fits most. So then we had Boris introduce us to Wendell Potter.
And then we did that week of claimable.
And we did 38 appeals.
That was
June 24th. I know these dates.
That's amazing because I didn't.
June 24th through 28th. We had Wendell Potter. We had Ash Gilbertson.
Oh my God. The most
Love.
stressful week of my life.
The weeks leading up to that, well, they were all stressful.
Oh my gosh,
Claudia had to do all of the patient coordination, which was
and print
huge.
all the paperwork, and it was because the AI hadn't learned anything yet.
We had 7 people from Claimable out here, and the lads, which are the IT architects, were out here in exam rooms changing code and saying, oh my God, this is our hypothesis, but this is how it plays out on the
And then
ground.
I'm getting all these signed patient
consent
forms for Ash, and he's like, I'm like sending pictures as he's like taking these pictures, and I'd say that gave us a good bounce for like a couple months.
Oh, for sure. And you know, it was very fulfilling and energizing to be working like 12, 15-hour days and then be like in this with patients and with these
Amazing
super energetic people. And we had some dinners out that were amazing. It was just like, wow, I feel like we went from here to here.
100%. Because also people they were just like, you guys know you're amazing, right? And we're like, we're just in
Just doing our job.
And
I had the opportunity to go on 3 patient interviews with Ash and
Wendell.
Wendell. And I got to have a McDonald's fish sandwich with Wendell freaking Potter. Like, does that get any better than that?
That's all over the news right now. Signal
Right.
whistleblower, the guy that got us into advocacy. Like after our first freaking time seeing him speak, Julie's like, we ran up there, and after that is like when the fire under you lit, and we're like, we're getting involved. We're gonna change things.
Yeah, and you know, I told her as soon as he comes off the stage, follow me, because he's had a suitcase. He was in a
He was ready to go. He was definitely ready to go.
Mama knew.
It was insane.
And we did a lot of travel this year. We went to the Surgery Center of Oklahoma City.
We met Marty McCarty.
Yes, who's now in the Trump administration.
If I get us, please invite me to the Oval Office.
Please stop saying please.
Please.
And then we did a bunch. Okay, so we had all that stuff going on. We had June 24th through 28th. We did the claims week. We filed 38 appeals, and then we had a very busy July, sort of just getting all of that stuff going. And getting patients on service.
And like checking up on it.
Following up the follow-up of the follow-up. And we had a very busy fall travel schedule. And then suddenly Dr. Bach got sick and he freaking died. My partner.
Days before your daughter's wedding.
3 days before my daughter's wedding, our daughter's wedding. Yeah, he freaking died. My husband and my partner of 34 years we were married. We've been together 36 years. He freaking died.
And you went and got your hair dyed.
Yeah.
Because like, I think that just goes to show like how you were just like, what?
I was in
I'm just going to go on with my normal, regular routine.
I had to do that for my daughter.
Well,
I had to do that.
In a way, I think it's kind of the most beautiful gift Dr. Rod could have given you guys, because he
knows I wouldn't have gone.
Well, and he knew, because he said goodbye to me, and I was like, what do you mean? I'll see you tomorrow, buddy. And then I didn't see him the next day, but it was like when we were sitting there, I saw like one tear fall, and it was just almost like he was like, wow, I don't know how much longer this is going to be going.
Mm-hmm.
And then I made sure to give him an extra hug, and then things just took a turn, and it was like, what's going on? I'm going to Julie's every day almost, and we're going on TikTok. Like, we're doing great. Everything's fine.
And he was getting better and better and better. And then all of a sudden he wasn't. And I don't know. It
but
was
you
a really
would have
difficult
stayed.
time.
I think.
Of course, I would have never left him.
Gone
ever.
And
I would
I
have gone to
think
Sarah's wedding.
that's something Dr. Bach, I don't think he would have wanted to. That's guilt. I think that would have broken his own heart, knowing he missed his daughter's wedding. And instead you guys had to have you had the ability to have this beautiful small ceremony.
Yeah.
And I think that'll be a memory. And then just even seeing the pictures, which I'll post a few on here, they're absolutely gorgeous. And it's just like, it couldn't have been more perfect. Like, the photographer focused on every small detail that there was. The shoes, there's 100 pictures of them. So if there was a flaw, I'd see it. Everything was perfect.
It was, for me, he was everything, but what struck me is not one time did he ever say, poor me, blah, blah, blah.
That's what
he put on a freaking tuxedo and had a mini wedding in our house and stood up for his daughter.
And
he is a better person than most people.
Anyone. And he called patients like up until the 3 days before he passed.
I mean, really, he was still doing patient stuff until the day he died. And he really was. He was a physician up until the day he died.
And the most patient. I mean, when I first started, I was fighting for every single patient. I was like, no, these people have to stay. It didn't matter what. And so my empathy was huge, but there would still be some patients that I'd be like, all right, I can't even help. And then Dr. Bach would come out and be like, I know this one. We're going to give them another chance.
Yeah, no, he was the best guy ever. And I know people kind of say that when people die, but it's different with Steve Bach.
No,
he was exceptional.
I think there's been many times when both you and I have been like, it should have been me. Like, I'm not making the difference he did. Julie, and it's so hard too, because he made such an impact that people want her to spend an hour on the phone with them talking about how great he is.
I know. And they're like, how come you didn't call me? I'm like, are you kidding me? But super amazing man whose life was cut short at the age of 63.
But I don't think I can't think of anyone I've ever met personally that has been able to make as much of an impact as him. He genuinely sold hope. Patients, I've never been to an appointment where I've cried afterwards because I felt hurt. And you just look at our TikTok. I mean, patients can't even get their doctor to prescribe a medication because they're like, your insurance.
Well, even on Dr. Bach's obituary, it's just over 100 comments about how he saved their lives.
And lots of patients wanted personal handwritten letters. And there's been times where I've had to be like, listen, we care, but I have to protect Julie. She just lost her husband, let's have some grace. And then but that's kind of where I also saw how messed up and unreliable our healthcare system is. As a specialty, we're supposed to be able to rely on the primary care physicians to work with us. Our physician passes away. Not a single one of them, well, I guess maybe one group, some of them, I shouldn't say that, but were willing to help us with the medications. They'd rather their patient go to the hospital with withdrawal. Whenever we're working on getting a locums doctor in here, we're just, give us a second.
Dr. Bach was the best because he took care of poor people, and he didn't want his patients to get stuck in the pain management surgical bounce back with their inflammatory rheumatology conditions. So he always prescribed controlled substances. Most of the time it was tramadol, but there were some Schedule II drugs, and nobody would help us.
And he always drilled in our head, we don't recommend surgery. We do not recommend surgery unless it's a very last option.
And it's because the surgical solution is not a solution when it's an inflammatory patient. You still have the inflammation and the rheumatology disease. Psoriatic arthritis, don't even bother. We don't care what your MRIs look like. We get that they're a mess, but we're going to still help you live with your disease. And that really was his mantra. No surgeries for inflammatory patients. So he wasn't a big fan of the hospitals and the surgery centers, which is they probably weren't a big fan of us, but that's okay. We always did the next right thing, and we still do. So then we have this horrid event.
You go to your daughter's wedding.
My husband dies. 3 days later, I go to my daughter's wedding. 2 days after that, one day after that, I fly back to St. Louis. The following day, we have his funeral, which was, I was in a daze, and it was an amazing funeral.
It was wonderful. It was wonderful.
The whole staff came, and I don't know, we had so many people there, and I wanted to
even
do it.
Some people that
we didn't invite. I don't even know how they found out about it.
How you doing, Exogen?
Right? But it was a really moving tribute to him. We had all of his favorite foods, which was one of them was rack of lamb. And just the most amazing foods, multiple open bars, and great slideshows, and it was fantastic.
Oh, absolutely, 100% was. I mean, Julie couldn't get away from the front door because people were holding on to her. She wore the wrong heels, I think, that day.
I did. I wore the same dress that I wore to my daughter's wedding.
She was the shoulder for people to cry on, but we made it past that. And then we went to Vegas, right?
Well, the next day I came to work.
Oh,
I took off
I couldn't get her to take a day off work.
I felt
she took half days.
I did half days, but I felt like I needed to be here because we needed a place for his patients.
Well, and our office was going wild.
And I needed to be here for the staff. I needed them to see me here.
Yeah.
Still working.
No, I think it showed strength and to not fuck with you, honestly, because I think people were scared of Dr. Bach, but they didn't realize you're the one to be scared of.
I think they knew that I was the one to be scared
I don't know. After that little debacle back there, I was like,
well, it was a really crazy time. However, all I know how to do is pick up a paddle and row for the shore. I can only cry in the fetal position in my kitchen for so long. I have to be moving forward.
And
boy, did
by golly, did she.
So here's the crazy thing. So we have his funeral. We come back to work. I have 4 trips planned with him and with this one. We have to freaking cancel all of his tickets and repurchase mine.
We didn't realize we had to repurchase hers until like a day before when we realized she didn't have a ticket.
Because I was on his companion pass. Nope. We went to Las Vegas.
And you received an award for
the Advocate of the Year for private practice for 2024, which was amazing. She spoke with Nilsa about social media, spilling the tea on social media being the new prior authorization. We did that at the Healthcare Advocacy Conference in Vegas. No.
Oh,
that was the right title. Was social media is the new prior authorization. So we did that. We were in Vegas for a week, but we had a really great time.
And we sat at Lisa Vanderpump's Vegas place, which was a highlight of my career. I love her.
Really? Okay. Actually, it was such a beautiful place.
The food, if Lisa would have been there, but
it's not really a food place. It's a vibe place.
Yeah.
But we also went to Hell's Kitchen, and Wars came out there with us, and Nilsa was by our side the whole time.
Her and Wars got in trouble for bullying.
Always. Actually, I was talking about that on Dr. Glockenflecken's podcast with Wars.
CBS was hosting it, so I had them.
You got the arsonist, CBS, creating the fire, and then the firefighter, CBS.
Engraving cups. So then I stood in line and I was like, I would like you to write angry dad on there because his son he was just getting traction for his son. And I was like, okay, let's put angry dad on there. And he's like, I don't know if it'll fit. I'm like, it will. Thanks.
So we did that. We were in Vegas for a week and then we came back here. And in between, even at Vegas, I was hanging out with and talking with my friend Brad on the phone, and we were like spending some time together, like just kind of hanging out when I was in St. Louis.
Yeah.
And his wife passed away, and he's someone that I've known for more than 20 years. And it's like at the same time that I'm mourning the loss of my husband, I'm like starting to like have like this friendship turned romantic situation with him. Which was like, what? I know. It was like pretty wild. I can remember being in Vegas. I got myself locked out of the room in just my underpants and then she wouldn't let me in.
I'm scared of stranger danger, which I think we should all appreciate. And I heard the bathroom door close and she's banging on the door and I'm like, oh my gosh, what? Like, this is terrifying. Someone's banging on our door. I'm going to get kidnapped. And she's like, Claudia, it's me. And I'm like, no, you're in the bathroom.
I don't like a mess, and there was some room service dishes, and I went to put them out in the hall, and I thought that I would flip that thing, and I locked myself out in the hall at Caesar's Palace in Las Vegas, and she wouldn't let me in. I'm standing out there in my underpants, no bra.
It was good.
It was a tough one.
It was interesting.
So that was that, and then we came back.
You bought yourself a Chanel scarf. We went shopping.
I did.
We can't forget that.
And I bought a really pretty sweater, that blue sweater.
And this jacket, this lesbian jacket.
When in doubt, we did some retail therapy for me. And then we came back. And then where did we go next? We went to, you went to Norm,
mm-hmm.
and Nilsa and I went to Minneapolis.
And Norm was really the first time I realized not everyone's wanting to work with us.
Okay, so let's talk about that. So Norm is the National Organization of Rheumatology Management. So that was an organization that we're still both a part of. They don't want me. They don't like me, though, but that's okay. I'm not everyone's
I'm guilty by association.
Of course you are.
But I mean, I still sat front row no matter what. I got a book.
And
and I answered all the questions like the annoying smart girl in class. And, I mean, we're doing things untraditionally, which I think makes a lot of people uncomfortable because we're not following the norm.
Well, but here's the thing. why would we do the same thing over and over again and expect a different result? Letters of medical necessity, those don't work. Insurance companies and pharmacy benefit managers, they don't give a rat's behind about what a physician's office thinks.
I just want to know is like, do they not realize that I honestly think we have a big part of educating the public because Moshiri, find the bottom 20%. We've found the bottom whatever
50%.
You know, like I can tell by the comments sometimes, you know?
Right.
And so like I think we've actually done and people are always like, you're the only channel I've seen talking about this.
Well, I only know how to do things one patient at a time. And when you take care of chronic patients in the zip code that we take care of them.
And when you've taken care of a loved sick one with the chronic illness, I think that is also kind of what drives us to be so passionate is we both have seen the system.
Yeah. And it doesn't work. It's so freaking broken. So broken. And these insurance companies, they don't give a rat's behind about the patients they allegedly serve. And they certainly don't care about the doctors and pharmacists doing the work.
Well, even in Wendell's what's it called?
Op-ed.
He said that not once did they talk about patients as patients. Like they were never referred to a patient at an investors meeting.
Right. All they talk about is profits and shareholders. They don't talk about members or patients. That's like, it's just inconvenient. But yeah, so you went to Norm. You got a frosty reception there.
Oh my gosh, but I got the best freaking frozen yogurt.
Okay.
Julie looked at the credit card statement. She was
like, what is all this?
You really did enjoy yourself, the frozen yogurt, because I got it like 3 times one day, and I was like, it was right outside my room. It was so good.
At least I'm looking at the credit card statement.
And then...
Okay, so then I went to Minneapolis, Minnetonka, the home of United Health Cartel and OptumRx headquarters, and I was with the PUT group, which is Pharmacists United for Trust and Transparency, with Lord Jeremy.
We love Lord Jeremy.
And they asked me to come and speak on behalf and dedicate the protest to Dr. Stephen Bach, who was a goat.
And I'm sitting there nervous wreck because she's away from me, and I was kind of like the right-hand person. Like if she has a meltdown, I've got the pen.
Right, but Nilsa met me there, and Nilsa and I had a great time, and I brought 2 of Dr. Bach's lab coats.
And they signed it.
And we signed them all. It was such an emotional thing, and I spoke at that, and that was great.
I think that's kind of
great.
Because we're like family now with them. Like I love them.
Yeah, they're the best.
Brandy, Monique, everyone. They're just absolutely amazing. And then I guess we started doing some like original stuff. What grind your gears, Julie? What grind your gears?
But you were doing what grind your gears last year, weren't you?
Yeah, and now they've just recently started like
restarting that.
And you've had insurance companies reach out to you and be like, stop.
I've had Aetna send me an email saying, get off TikTok. We've had Cigna send us a cease and desist letter. What? How can this little itty bitty tiny practice in Bridgeton, Missouri, who takes care of poor people and people that are barely making it, get underneath the skin of multi-billion-dollar international companies said no.
That was the first time.
We must be doing something right now.
I was stoked about something, and she was actually really nervous, and she's like, maybe we'll tone it down a little bit. And I'm like, Julie, we're getting in these people's freaking heads. Like they just spent money to send a cease and desist to a private practice in Bridgeton, Missouri.
We are so insignificant in the big ball of healthcare, like so insignificant. And Cigna is a huge player, and whatever we're doing is underneath their skin. And then after that, I copied their lawyer, Dan Ryan, on 200 emails.
You had the 4 folders you have were just lodged with like evidence proving that everything we've said is true.
Yeah. So all they did was give me material for a slideshow. So thank you, Cigna, because but for you, I would have never met Boris Bakari and Claimable, and I've never been able to help as many patients. Never met Wendell Potter. Never met Dr. Glockenflug.
Mark Cuban would have never followed us.
Mark Cuban actually. Oh, then we had that on.
And he emailed
August 6th. No, August 5th. Before Dr. got sick, Boris and I were on the phone, and he and I were in an email with Mark Cuban, and Mark Cuban tweeted that out about Express Scripts, and that was like that's pinned on my Twitter account. Like what?
Yeah. No, literally me and him and I's email. I was like.
I mean, listen, little insignificant people, us, can do big things. And we do big things because we do the next right thing. And we just, all I'm looking for is a pathway to take care of my patients. And if the insurance companies would show me that, I would get off their Dick Van Dyke.
Just don't give us anything to talk about.
It's too late because they've upped the game even more.
Well, that's like all of this, like, I urge you to tone out the critical noise. Like
Sir Andrew Whitty saying in his internal email to his staff at Optum and United Health Cartel, tone out the noise because it's not reality. Guess what, Whitty? It not only is reality, but now everybody sees you. And now we're all talking about it and shit's going to change. Shit's going to change. It's happening.
It is.
It is absolutely happening. Okay, so then
after we went to Tennessee.
Then we went to Nashville, Tennessee, to the CSRO, that's Coalition of State Rheumatology Organization.
And got in trouble again.
I did a terrible job of packing, and I had to wear her $12 dress. But somehow I looked great in it.
She's like, I can't wear this. And I looked at her and I go, well, I can't wear it after you put that on. I don't have a boob job. Like,
well, we don't have to tell people all that.
It just fit her. It fit her body perfectly.
It really did.
And I was like, I can't wear that after you. And then the next day I was like, wait, I can't wear the same dress as her. It's going to be who wore it better. And Julie's like, take the credit card. And I was like, all right.
And you got a rockin' cute outfit. That Nashville trip was such a good time.
It was so
Morris met us down there, and Nilsa was there.
The puppy.
And we got to meet, the puppy. We got to go into honky tonks. I loved that. We went into some cool bathrooms. And we also got to meet Pramod John from Vivio. Yeah.
Whom, if you tuned in yesterday, we had an email with. He promised that this would be different, and it was it?
It actually wasn't different.
So we're
never getting back together. But you know what? He backed down because I don't back down.
Nope, she doesn't back down.
And we got the patient stable on Enbrel to continue that because Vivio Wizardry wanted to change her, do a non-medical switch to Inflector. This poor patient that works at freaking 7-Eleven. She's 67 years old, is a cashier at 7-Eleven. And these morons at Vivio are like, oh, well, one size fits all. Just switch her to Inflectra. Well, nobody infuses Inflectra. And the patient doesn't have 2.5 hours every God knows how many weeks to come sit in the office.
Well, I think it's absolutely disgusting, like what health insurance is going to do, like with all these non-medical switches, how they're not acknowledging the fact that they're not the same. And we could have someone stable on it, you change it. Do you know how hard it is to find another medication that works for them?
It can take years to get somebody stable on a medicine.
To find a doctor patient enough
to work every single one. But this is like so unsustainable. And that's what we're seeing coming, just everybody exploding on healthcare.
Everyone sharing their stories on.
Oh,
I think we've actually opened the door to people feeling empowered to share their story on social media.
I mean, listen, what are you going to do? Going to cancel me? Go ahead. Everybody's a patient and everybody has been denied.
Everybody already doesn't like me.
And I'm not really looking to make friends. I'm looking for a pathway to care for my patients. That is what I will go down saying.
And working here, I've noticed more than anything, the system taking advantage of disabled or elderly.
And poor.
And right, like
you don't have any resources, you screwed.
It's disgusting because like even like the manufacturers of these drugs have patient assistance. Like, yeah, they're making so much money, but they have patient assistance for people that can't afford it.
But they're not making as much money as the insurance companies and the pharmacy benefit managers.
And they continue to create additional branches, these insurance companies, and like find ways to increase their revenue. And it's like, but the outcomes of our healthcare in America are the worst.
The worst, and it's the most expensive. And the whole sole job of a pharmacy benefit manager, and I'm looking at Optum Rx, Express Scripts, and CVS Caremark, was to reduce costs of prescription drugs. And they've done nothing but skyrocket. And their profits are all just middleman fees for doing none of the work. This has got to change.
Well, we've seen patients go blind. We've seen patients not be able to walk. We've seen
we've had a patient a pharmacist that works at CVS that was denied infusion drug for her, and she had uveitis. She went blind in one eye, and CVS is like,
sucks. You need to try this other drug.
Yeah, why don't you try try just taking a bunch of prednisone and see if you can lose vision in your second eye.
These huge, like, buff, big men that you would never think would, like, be so emotional are, like, coming up to us. Like, I would have never, thank you. Thank you for asking if I needed help, because otherwise I would have been stuck in this.
Yeah. So I think that one of the things that we do really, really well here is we look at patients as individuals. We don't just say that and say blah, blah, blah. We actually do it. And by doing that, patients get individualized care. And then if the therapy plan is denied or delayed by the insurance companies, that comes here. And trust and believe,
We're your worst
if a doctor
nightmare.
tells me that I work for, if they tell me this is the medicine that patient needs to be on, I don't have any questions. I will get it done.
You have no problem being sassy to the people in the middle because you know what you're signing up for. I worked at the car warranty industry. I've read a script. I've done the whole deal. You know, that's why they have the script. Otherwise, they wouldn't need a script.
We've uncovered so many bad players. We had the one with Mark Cuban who tweeted out about Express Scripts, where the Express Scripts specialist at Presidential Escalations had called up and said that she was with the doctor's office. Why? Remember that?
The one that filled out the assistance
Yes.
paperwork?
Yeah.
And then Optum turned the sprinklers on her, thinking she was the Wicked Witch of the West or something, but she didn't melt.
Don't you worry. This hair, I can blow
She
this
hates
out
when
again.
it gets wet,
I do
actually,
hate when my hair gets wet, but
so
that's
they
okay.
did the research.
Yeah.
Maybe.
So when we went to the Optum RX protest, they had the thugs of Optum, all these big bodybuilder guys going, "You got to get off our property," and then they turned the sprinkler. I'm like, whatever.
And those are the
Mermaid hair,
people
don't care.
saying we're harassing and bullying them.
But we also met some amazing people in 2024. Lord Jeremy, Brandy, Monique,
Todd Urey,
Angry Dad, Bill Schleikensticker, whatever.
Angry
his
Dad
name is.
WI,
Right.
Bob,
Angry
or
Dad.
Bill. I'm so sorry.
And it's Bill with one L too. That really throws me off. But at Angry Dad WI, which is Wisconsin.
Well, and patience,
and
even
Matt
people-
Ort, and like all of those
and
people.
Frank and Patrick and
Right.
Loretta, I feel like.
Loretta was amazing. Is amazing. And we've just met some really great people. But again, what do we have in common?
Nilsa, we already knew Nilsa, but I don't want her to listen to this and think we didn't shout her out.
Nilsa's the bomb. The bomb. Nilsa's the first one that got me on social media on Twitter. Here's the thing. Every one of us is a patient. Every one of us has been delayed or denied by our insurance company.
Wendell. Sorry, we didn't mention him.
Warris, Wendell,
Dr. Weisbart.
Ash.
Oh, I love Ash. And you got to meet his girlfriend.
Dr. Feldman.
Oh, Dr. Feldman. I'm so sorry that I started off on the wrong foot, but I guarantee the other one will probably fall right
In behind. We've really had an amazing ride this year.
It's been a hard one. It's been absolutely, sometimes it's been like back against the wall. Like, how much longer can we take it?
You know what? I have come to realize I do my best work with my back up against the wall. You want to see this old girl throw down? Put her back up against the wall. I will come out.
We'll scratch.
Swinging
We will scratch
and
our way
fighting.
up.
And I've had an opportunity to go to New York. Unfortunately, Claudia didn't go, and that was
Her
my
partner
fault
did.
because I have a new partner, and he's also my
And he made the companion pass
Right.
because she wasn't ready for the commitment to have me
right
for a whole year.
But you also had your
No, Texas was so fun. I did skip out on a couple of the like random billing things. I was like, Julie's never gonna have me do this. I don't think.
No, and
so
you need froyo or
I need to go
whatever
eat
it
as
was.
much froyo as I
But
possibly
we
can.
really have overall. I mean, despite the fact that I lost my Steve Bach, who was the greatest of all time, we've come out okay. We're still standing. My shoulders are back. My chest is out, and I am walking through this with grace because we still have patients to help.
And healthcare is not getting better.
Healthcare, but I think for right now, we are teetering on the brink of
Change.
extinction and change and get these PBMs the hell out of healthcare. What I would love to see for 2025, if I could make a wish, would be to dismantle United Healthcare, Optum, Express Scripts, Caremark, Aetna, and Cigna.
Save on
Anthem.
SP, save on, save
All of
our
them.
Rex.
Get rid of them.
Keep
That-
doing your research. You won't find anything. It's all public record.
That would be my wish, is that we go to direct care and we remove the middlemen, we remove the roadblocks of prior authorizations, we remove the pay to play list and the formulary and step therapy and all the things that make healthcare shitty for the people and make profits for the shitty people at the insurance company. That is my hope for 2025.
I was talking on TikTok the other day and I go, I have a feeling 1 year from now, I'm not even going to remember where I am. Like things are going to go so like our trajectory is just going to increase so fast. And I don't even think we'll remember sitting here like being like, this is our year in review.
Well, we will, because we will watch this back. But my message is one of experience, strength, and hope, that we do hard things. We do hard things personally. We do hard things professionally. But at the end of the day, we lift patients up and we get them to live with their diseases. And the insurance companies want to tear patients down because we've all experienced that.
Well, and we're the ones, we'll sit there and genuinely cry with patients. Like there were some patients, Sally, freaking, like, I'm just like, they hugged me and I'm like, that's when I'd lose it. Cause they'd just be like, I am so sorry. And it was like, no, I am so sorry. Cause like these ladies were in love. They were in love
with Dr. Bob.
And they told Julie, like, he's my man. He is.
It's all good.
And
he had
Julie,
nuns that were like, we're going to run off together. I'm like, okay.
Gosh. But it was just, I guess we got his can-do spirit.
We do have his can-do spirit. We have his can-do spirit.
And Julie is the one that suggested I make a dance today. So we have his dance moves also.
And we're going to do that. And we're going to teach it to however many staff want to participate.
It's just going to be us.
Okay. Well, I'm here for it. So,
but anyone that wants to be in it, we would love to.
I just feel hopeful. And I feel more hopeful because of the events in New York with Luigi. Because for the first time ever, the United States of America, the people, we the people, are saying, that's it. We've had it with the insurance companies. We've had it with their multi-billion-dollar decisions, profits, salaries, all in the backs of the patients and the taxpayers of the United States of America. So I am hopeful for what change is coming in 2025, and it better be, and it should be, the next right thing, which is to get rid of the health insurance companies and the pharmacy benefit managers.
My goal is to be is to make sure these copay accumulators, like if anything, we just need them. Once I get them rid of, we're done. Then the pharmacy benefit managers will be next. We need to keep them from making these branches, these stupid.
Well, the revenue streams have revenue streams at insurance companies. And that's like, it's so incestuous. I mean, United Healthcare is the largest employer of physicians in the United States of America. 9 physicians have sold their soul to work there. What? Who would want to do that?
Someone that can't afford their student loans.
Okay, well,
you know what?
They get out with their back. I just feel like I have, at the age of 60, I have fewer days in front of me than I have behind me. And by God, I'm going to make every one of those days count. And if I can help people, I'm going to do that. I'm going to do the right thing.
I always do the right thing. Otherwise I tell on myself. So it's best if I just do the right thing. It's my character. Character shines through at the end of the day. And I think it's really done that with insurance this past year too. My hope is that more people feel empowered to use their voices and stand up against insurance companies and call Congress. Like what? That's a big thing we did.
The 50 sponsors, we helped with that. First time caller, long time listener. You're on the air.
4 co-sponsors
in one day. Working with Jeremy and the team at PUT to get the House HR 9096 on the floor. It'll be very interesting to see what happens, because if it's anything short of rubber stamped approved, and the pharmacy benefit managers are going, mother of pearl, we are so screwed.
But they're suing.
But you are.
They're suing the people that are giving them bad reviews. So it's like, and then they're trying to dismantle the FTC. I meant to ask you about that. How do you do that?
I don't know. But you know what? The big, the powerful, the elite few, we done with you.
Yeah, we're never getting back together.
We're never getting back together with Optum, Express Scripts, or Caremark.
Or United Healthcare, Cigna,
nothing to do
Medicare
with
Advantage in general. Hopefully, we'll be moving towards our direct pay model.
Yes. You know what? Healthcare needs to be affordable and accessible.
And transparent. Like, transparent. It should just be, I prescribe this medication, you're going to go, and it's going to be this amount.
That's the prior authorization, is the prescription, not the bullshit with the labs and with the charred nose and going to India and we can't find this and that and blah, 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 blah. So
we're not backing down anytime soon.
Merry Christmas, Happy Hanukkah, Happy Holidays, Happy Kwanzaa.
I was going to say.
Happy anything
New Year.
Except no happy to United Healthcare.
And Medicare Advantage plans.
Oh, Medicare Advantage is the worst. It is the worst. But
Andrew Whitty, Gail, freaking
Bordeaux,
Cordani, you guys,
David
I hope you
Cordani.
get coal.
I mean,
I hope the pictures continue to get posted.
yes.
And if you guys ever feel like you want to be on our podcast, the door is open.
Right.
Always.
It is open until we slam it in your face. But we'll do that after
Or
we
turn
talk
the
to you.
sprinklers on.
Fiddlesticks.
And that is the end. How do I?
Don't ask me how you do something.